You're speaking on the genetics of eye colour and colour vision. Can you tell us what the key messages are of the lecture that you gave?
Well, the key messages that I hope to present were that ophthalmology, in particular eye colour and colour perception, are very good examples to teach the general population about basic genetics and even more complex genetics. If we look at eye colour, brown eyes are dominant, blue eyes are recessive, and albino eyes are also recessive, the extreme end of the phenotype. With people who have colour perception problems and are colourblind, they will perceive eye colours differently, and that's due to an X chromosome abnormality. So just in that very simple example, we can show what dominant, recessive and X-linked mean. If we go beyond this, we know that the colour receptor genes, the red and the green ones, are actually copy numbers of the same gene that have changed subtly. And this is becoming a common feature of many different genetic diseases, and thus we can teach this phenomenon through the basics of eye colour and colour perception. Another area of research that's becoming more interestingly expressed is when people have some genes, they may be turned on or turned off, and this is called epigenetics. And the eye colour perception genes are on the X chromosome, and in women who are carriers of colour blindness, these genes can be turned on or turned off, and you may be running on a patchwork of mother's X chromosome or father's X chromosome, but very rarely there's a skewing of this inactivation, and a person may be totally like their mother or totally like their father. And when we look at twin studies, when we expect twins to be exactly the same if it's a genetic disorder, you can have girls who have one of the twins being colour normal and the other one having colour blindness like her father. And although this applies in this ophthalmic example, in many other diseases we may see this as an explanation for identical twins not being the same.
About what you're currently researching.
So I've got a great interest in the genetics of eye diseases. When I started, the most common diseases were inherited retinal diseases. But what has happened is we've expanded into almost all areas of ophthalmology. So we now know there are genes for age-related macular degeneration, very much so for glaucoma, which turns out to be one of the most heritable diseases of all diseases, not just of ophthalmic diseases, and then of cataract, and many of the pediatric syndromes, corneal diseases. So genetics should be part of the armamentarium of every practicing ophthalmologist, and we need to make sure we ask every patient with any disease, do they have a family history? In the near future, we'll be having people being genetically tested and turning up with a gene profile showing that they're at high risk of different diseases. And what we're doing is looking at what are the genes that put people at risk for disorders like glaucoma, and then can we apply this in clinical practice? So rather than telling people you have the genes that put you at risk for glaucoma, we can say your risk of glaucoma is very high or low, and even though your mum or dad have glaucoma, you need to worry more or less than your brothers or sisters.
Your findings in the genetics of glaucoma for the treatment of patients?
Firstly, the advantage of finding genes is that we can predict who might be at risk of the disorder. With glaucoma, a major problem has been undiagnosed glaucoma in the community. We have tried to improve families telling their relatives that they're at risk of glaucoma, and this has improved the screening we've definitely noted in Australia. But by having a genetic test, we hope to do this more definitively. Another aspect of finding the genes for glaucoma is that we can look at what's the actual molecular pathway that's involved, and can we look at new treatments, or more importantly, treatments that we already have for other diseases that can be repurposed to act on that particular pathway, and therefore have new and better treatments available for us with treating glaucoma patients that are very personalised for their underlying genetic risk factors.
What do you feel should be the biggest priorities for ophthalmology today?
I think the biggest priorities are looking at the genomics, big data and artificial intelligence revolutions that are happening. And very excitingly, ophthalmology is at the forefront in all of these areas. So I think we need to be looking at how are things changing in the very near future and the longer term future, and be aware of this, and attending congresses, listening to speakers, and helping support and participate in research is important for us all.
Thank you very much. That's great.
Okay, thank you.